What really makes people look old is life in the fast lane. You know, you drink too much, you're using drugs, etc. That really takes a toll on your whole body, but especially on your skin. So there's other things going on in aging. We know that shingles, for example, happens to older people more. They lose immunosurveillance. Over time, you get sun. You know, you get sun just getting out of the parking lot. It's not the beach or tennis. You're just living, you get sun. And in Hawaii, everybody gets sun. We have sun all the time here. And we have a lot of skin cancer, especially in older people who are fair-skinned. Caucasian people get a lot more skin cancer. And we have keratoses, which are premalignant. So we see all of these things in older skin. So when you look at older people, you'll start to see these changes that are sort of intuitive to us. We could tell an old person just by looking at them. And I'm going to show you this. So on the left, we have natural aging. This is intrinsic aging, which is pretty benign. Wouldn't you agree? There's not too much atrophy or trouble there. But on the right is the sun-exposed area of the dorsal of the hand. And when you look at that, you'll see that there's kind of irregular pigment, and also the skin around the wrist looks a little bit more wrinkly. So the situation is that aging in two categories is probably worse in the external causes, such as sunlight and internal problems, renal and kidney and other problems. Okay, now in dermatology, we use language so we can talk to each other. So we don't say, you know, patient has a rash. So that doesn't mean anything to us. So we use these ways of describing things, and we have nouns that go first. So we say all these different things. I want to draw attention to the plaque. Most people have no clue what a plaque is. A plaque is an area where the skin is raised from around the surrounding skin. So if you're blind and you run your finger across it, you can go up and then down because you can feel where it's elevated. So most of these other things are pretty obvious, with the second exception of patch. A patch is very important to know because a patch is a flat area that has something interesting about it. It's red or it's losing color, but it's not elevated, it's flat. For example, a freckle is a macule, but a birthmark could be perfectly flat but dark or black. That would be a patch. Okay, so then we have colors. I think most of you know these colors. I just want to tell you the difference between hyperpigmented, hypopigmented, and depigment. Depigment means there's no pigment at all. It's perfectly without color, for example, in an albino. Ecchymotic is an area where there's a big area of bleeding under the skin. A smaller area is purpura, and the tiniest one is called petechiae. So petechiae is pinpoint bleeding under the skin, a little bigger is purpura, and a big area like a motorcycle accident is going to be a big ecchymosis. And then we use these. I'm not going to go into them because I have a lot to talk about, but I want to just mention to you, these are the things that give us more and more information. So we say, this patient has an erythematous plaque, a red plaque that's weeping. Then another doctor, another dermatologist can vision what's going on here. So when you're seeing your patients and you're evaluating your patients, if you put in your notes these things, somebody else who knows dermatology will be able to pick it up a little bit better. And then we use these as the last thing. So I want to tell you, annular means a ring, but polycyclic means many rings put together. So you would have, like a pretzel is polycyclic. Okay. Now, this is important. This is also used in burns. Dermatologists generally don't take care of burns, but we use this area because we have to get prior authorization for a lot of the new drugs. And a lot of you know that's a headache, right? Getting prior authorization for medicines that your patients need. We have to describe the area in order to qualify for these drugs. So we all know these sizes. A palm with the digits like this is 1%. So if you go over your body, you'll get 100%. Upper extremity is 10, lower extremity is 20, and the rest are there. These will be in your notes so you don't have to memorize them. But there's a question later about the body surface area, and this just gives you a sense of how bad the problem is. And then we have these other scores of redness, etc., from 1 to 4. Okay. Now these are papules. This is a disorder called lichenitis. We're not going to go into this, but it's tiny little bumps. They're papules less than a centimeter. Now, this is an example of a macule. So this is vitiligo. I think most of you would recognize vitiligo. It's kind of like a hypopigmented or depigmented area. And if it's bigger than a centimeter or a centimeter and a half, then we would call it a patch. If you remember, a patch is another flat area, but it's bigger than a macule. Now, this is somebody with psoriasis. Around the umbilicus, you'll see that big plaque. You can imagine if you run your finger along the edges, you can see where it would go up. But above the umbilicus, on the patient's right side, you'll see those red bumps. Those are papules. So the patient has plaques and papules of psoriasis. These are tumor nodules. And notice on the left forehead, there's crust and scale. So these are, patient has red or erythematous dermal nodules with scale and crust. Now, these are bullae or blisters. Some of them are small enough to be vesicles. So vesicles are filled with juice, but they're small. And a bulla is a bigger one, also filled with serous fluid. And these can be tense or they can be flaccid. This is a flaccid one, probably in a patient with pemphigus. So when we were talking about this, I would say, now this patient, it's on the phone with somebody. I got a patient here with a vesiculobullous disease. I got a patient here with a vesiculobullous disease with flaccid bullae. If you look, you'll see some of the areas look crusted because when the top comes off, then you get that eschar, like a scab. Now, let me tell you about this. This is not a geriatric patient, but it could be, because there's a patient with these tiny little red bumps. If you look carefully, you'll see those red spots, but hidden in there in the middle is a tiny little vesicle. So keep in mind now, this patient is febrile, and so you're going to be thinking about this. So we want to know if this is herpes or drug reaction or varicella or contact dermatitis. Herpes simplex are grouped blisters, so it's probably not that because these are scattered. It's probably not a drug reaction. Why isn't it a drug reaction? Because the patient is febrile. Most of the time, if a patient is given, for example, how about lamotrigine, how about allopurinol, how about phentoin, and they get a rash all over, they're not going to be febrile. So it's probably not that. And contact dermatitis is not patchy like this. It's in a larger area. So this is going to be varicella. Varicella is chickenpox, as you know. So chickenpox presents, the patients have a fever and they have little blisters all over. We see this problem in young people, but we're also seeing it very severe in HIV patients. And you probably are taking care of some patients with HIV, older patients, because they're living longer and they can be prone for these disorders that we normally think of in childhood. Okay, this is an ecchymosis. I think this guy got into a fight and his left eye is closed and it's kind of discolored. And then this is a purpura. Actually, this could be an ecchymosis. These are bleeding under the skin. This is big enough probably to be an ecchymosis. This is an abrasion on the nose. Now, this is back to the psoriasis patient. So you may remember we talked about what these are. And so these are papules and plaques. The plaque is around the umbilicus, and the little red bumps that are scattered are papules. Also, up right under his shirt is a plaque too. Are we doing okay so far? Everybody with me? Okay. I know I'm going fast. I have a whole load of slides to get through. Now, one extremity, upper extremity, is 10%. The abdomen is 10%, and the scalp is 24%. So, again, in your notes, in your handout, it would be good to take a look at these. So when you say to yourself, how bad is this problem? If you go through the coverage of it, then you'll know. So some of our patients don't come in with just one little lesion. They have something all over them, and this is when this comes into play.